friends, it's What the Diagnosis. We're doing another case study. So we have a 24-year-old patient that is brought in by their family because they've been acting a little bit different, right? Over the past few months, they've been more withdrawn. They have stopped hanging out with their friends, stopped going to work, and spend most of their time alone. Their family has reported that the patient has been speaking to themselves and sometimes even responding when no one else can hear. The patient says things like, people are watching me, or there are messages being sent to me through the TV. They've also been neglecting their hygiene, not showering regularly, and also not eating well. During our assessment, their speech is disorganized, their thoughts are very hard to follow, and their emotional expression is very flat. So, what do you think this diagnosis might be? Alright, friends, so the most likely diagnosis is going to be schizophrenia. So schizophrenia is a chronic psychiatric disorder that affects how a person feels, how they think, and how they perceive reality. Symptoms are typically grouped into 3 categories. So we're going to have positive symptoms, and that's your things like hallucinations and delusions. We're going to have negative symptoms, and that's like their lack of motivation, social withdrawal, like we mentioned, a flat affect, and disorganized thinking or speech. So according to the DSM-5, right, symptoms must be present for at least 6 months with at least 1 month of active symptoms. So the treatment for schizophrenia is really going to include antipsychotic medications, therapy, and having a real strong supportive background. So, as a psych MP student, what I'm learning is that what looks crazy to maybe the outside world is literally completely real to people who are schizophrenic. So they're not just trying to be difficult, they're trying to navigate a reality that honestly feels real to them. With early intervention, doesn't just help, but it can literally change the trajectory of someone's life. So that's What the Diagnosis. Follow more for more episodes and case studies on psychiatric diagnosis.